Welcome back. Thank you for joining us here on OPEN BxRx Tuesday. This week, the Whole Health Report, sponsored by Empire BlueCross BlueShield, is back. Today, we are welcoming back Laura Brosen, a registered nurse and a clinical quality program director for Empire. Our special guest today is Dr. Christina Pardo, Deputy Director of Life of Hope. Thank you both for joining me.
Thanks for having us.
Thank you.
Now, today we're here to talk about maternal health. Laura, can you actually just start off and tell us a little bit more about that?
Sure. So the Bronx and Brooklyn have the highest maternal mortality rates. And in fact, the women of childbearing age in the Bronx have the highest prevalence of high blood pressure, obesity, and diabetes in New York City overall, which contribute to worst outcomes and comorbidities, which have high rates of preterm births and low-weight babies. So Dr. Pardo is here today to talk about maternal health and what we can do to address some of these issues. Dr. Pardo, what can we do about some of these disturbing statistics that we just saw?
Hi, and thank you again, Kibin and Laura, for inviting me for this important discussion. Actually, first, I would say that to add one additional comment to the slide that was just shown, is actually those are the rates for what we call severe maternal morbidity. That is when somebody who is pregnant becomes really, really sick in pregnancy and is considered a near miss right before a death. A death is still technically is still rare, and so we study severe maternal morbidity. And what we see is that the Bronx and Brooklyn are really the hot spots for severe maternal morbidity and New York City. And this is important for many reasons. This lets us know how we are doing health-wise for a community. These communities also tend to have higher rates of chronic illnesses, as was discussed, cardiovascular disease, and maternal morbidity is something that lets us know how we're doing as a society. So it's not just about our health, it's about what access do we have in our communities? What access do we have in our hospitals, in our health centers? Do we have the same healthy and accessible neighborhoods and communities? So it's about what's within our healthcare, the health of ourselves, and also what we have available to us in our communities.
Now, what are some warning signs our pregnant listeners should be aware of?
So if we go down the list of the top causes of death related to pregnancy, the top causes are cardiovascular disease, again, a reflection of the chronic illnesses. Hypertension, if you had hypertension, high blood, and uncontrolled diabetes prior to pregnancy, you have increased risk of cardiovascular disease and other complications. Pulmonary embolism, which is when you can have a blood clot that goes into your lungs and blocking the blood flow within your lungs. Preeclampsia, which is a high blood pressure and seizure disorder of pregnancy, and hemorrhage, which means when you lose a lot of blood throughout in your pregnancy or delivery. And each one of these have important warning signs. Obviously, cardiovascular, it's really important that when we're pregnant, that we stay up to date with our general medical conditions, our high blood pressure, our diabetes. Pulmonary embolism we do have higher risk of that in pregnancy, and the signs to look out for: shortness, difficulty breathing, chest pain, feeling like your heart is racing. Preeclampsia, if you're having a headache, your vision is not the same, you're not feeling well, especially if you're in the later third trimester of your pregnancy. And hemorrhage, obviously, anytime you have severe pain and bleeding, this is always time to come in to be evaluated. And I will say these risks do not end with delivery. They continue after your delivery up to 2 months and even beyond. So if you're not feeling well, your blood pressure is not controlled, anything is going on even after your delivery, it still requires evaluation.
Thank you so much for actually adding on that part, because I think that a lot of people just think about the pregnancy itself, but there's also so much that can happen afterwards. So thanks for clarifying that. Now, I'd really like to know what's being done to improve maternal health in New York City.
So, I will say there's really been there's a lot of work to do, but there's been a lot of great work at all levels since we put a focus on maternal health conditions. There are programs throughout the state where there is a New York State Birth Equity Initiative. New York City Department of Health has a maternal hospital quality improvement initiatives, as well as work through their Center of Health Equity, where they have locations in both the Bronx and Brooklyn, as well as in Harlem. They have expanded the citywide doula initiative. Of course, doulas are support persons throughout your pregnancy to help advise, to help advocate, and are proven to have positive benefits. So we're really fortunate that we have all hands on deck, which includes our health insurers like Empire that have gotten into this work to see how we can all work together to combat this. And, we're fortunate here at Life of Hope to partner with the Empire Foundation in an outreach initiative in which, really our goal is to meet women and families where they are. Bronx, much like Brooklyn, if we wait till somebody walks in the door, we're going to miss the majority of people. So we have an initiative supported by Empire Foundation that will support an outreach van and really engage in people where they are, not just physically, but culturally, socially, and really be able to engage and refer persons to services before they tell us there's a problem. We really want to get at the root and not wait until it's the third trimester of pregnancy or postpartum, and then we're uncovering that there's an issue. So it's really all hands on deck, and we're fortunate to partner with Empire Foundation, and we're fortunate that our city and state agencies are working towards this as well.
Now, Laura, can you actually tell us a little bit more about these grants and their focus?
Sure. Our parent organization has committed $30 million over the course of 3 years. About $14 million has been allocated to date. In New York, we're working with 3 organizations, and Life of Hope, which Dr. Pardo is part of, is one of them.
All right, thank you. Now, I know it's important to be your own advocate when it comes to your health. What should expectant moms talk to their doctors about?
So what I always love to tell patients, community members when I'm doing forums like this is to always remember that they are the star of the show. You are the star of the show. We are doing all of this because of you who are pregnant, who have families with children, and accessing care. And this is all about how we improve the care for you and improve the services for you. So if there is something that you do not understand or do not feel was explained properly, please do not feel timid, and that is our job. Every hospital has a patient relations or patient experience office who you can turn to if you have any questions or concerns. You can also go to same thing through your health insurers if you have any concerns. And I know many are doing surveys of their own for quality measures. This is part of our quality in the care that you provide. So please do not forget that you're the star of the show. Ask questions, ask clarification. If you have a concern, please raise that, and know that there are a lot of resources that are out there. So if you feel unsure or embarrassed, there are a lot of resources out there just for you. So please, do not be timid. That's why we are all there.
All right, Dr. Pardo, thank you so much for joining me. Laura, thank you so much for joining. Can you actually tell us a little bit about the resources?
Sure. There's, I think we have a slide. Yes. So you can go to empirebluefindhelp.com and see resources in your area. There's a program, BX Healthy Start, with Einstein Montefiore that has free programs you can access if you have no insurance. There's Healthy Mothers, Healthy Babies, and that program is an advocacy program that can help So that's another great one to access. And you can see these websites posted.
Thank you, Dr. Pardo and Laura. I'm glad you're here to help promote a healthier Bronx. Laura, we look forward to having you back soon with the whole health report from Empire BlueCross BlueShield. That's all for our show today. Thanks for tuning in. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always. See you next time.